And we're joined now to talk about this by Dr. Sharon Nyatsanza, Deputy Director of the National Council Against Smoking. A very good evening to you, and thank you so much for speaking to us. I do apologize if I'm pronouncing your surname correctly. Please feel free to correct me. So how big is this trend? We see it as almost commonplace now, seeing young teenagers at malls or in public vaping openly.
So thank you so much for making time for this I think it's a very important discussion that we're talking about today. So the issue of vaping in children really, it's not fiction anymore for South Africa. Actually, it is reality. We do have a problem of kids vaping. And I think the study that you just mentioned just highlights the problem of how highly addicted some of these kids are. The study actually shows that 6 out of 10 of those who were surveyed actually have to vape within the very first hour of waking up. And 23% of them cannot go through a school day without vaping. So really, we do have a problem. And we know that we need more studies, but as a National Council Against Smoking, we actually even have been going around schools. We've been getting calls from principals, teachers and schools to come and talk to kids about the growing problem of vaping that they are witnessing within their schoolyards. So it is a problem and it needs urgent attention.
So for those who aren't familiar with vaping or the properties of what is in an e-cigarette, as we mentioned, that many people, even parents, believe that it's less dangerous than smoking. But there have been studies over the years warning that it could have an even more detrimental effect on the health of those who vape, more than people who actually smoke.
Yes, so with vaping, really, I think you really underscore the important fact that vaping is very harmful to health. For South Africa, we have seen vaping for over 10 years right now, but the problem is that it's not regulated. So in terms of what exactly are the ingredients, or let's say, yes, we do know, for example, that most of them have nicotine, but in terms of how much nicotine is in these products, sometimes we actually do not know. And those are some of the problems that we're facing. There are a lot of metal as well that come with e-cigarettes. And unlike cigarettes, vaping actually is very diverse. The harms of vaping actually can even vary depending on the battery, depending on how the user uses it, depending on the heating, etc. So it's actually much more diverse. And in terms of the harms, we already see that in terms of short term, we already see that there are problems being reported scientifically with how it can harm, the respiratory system, how it can harm the heart as well. And obviously, what we do know for sure is that for teenagers, for youth, for adolescents, they should not be vaping because nicotine actually damages the developing stages of an adolescent brain. So we know that, for example, that the brain develops fully at 25 and over. So when they are below 25, nicotine actually damages the developing, process of, the brain development actually. So it's very, very harmful for kids, and we shouldn't be seeing kids vaping. But the problem, like I mentioned, it's one of the reasons why we're seeing a rise is because it's not regulated. They are packaged in very fancy packages, they are sold in very fancy flavors like bubblegum, which actually are being attracted and targeted at the youth. And we see, for example, that in almost every mall now, we see that there's a kiosk somewhere for vaping. So the issue of non-regulation is very, very problematic, and that really is one of the key drivers of the youth vaping epidemic that we're starting to see in South Africa.
And what I find fascinating is obviously during COVID there was a shutdown on the sales of cigarettes, and you could actually order that on some of these delivery apps. Now what you find that there are tobacconists on these apps that actually do deliver vaping products, but you can no longer buy ordinary cigarettes. Just in terms of regulation, is there an understanding a comprehensive understanding on the dangers, the harm that vaping could cause. I believe that, contrary to what some people believe, vaping can also cause cancer.
So definitely the issue of regulation that you're mentioning, we do have current tobacco control laws, but those laws specifically target tobacco products. So in the definition of what is regulated, it specifically states that the current laws regulate products which contain tobacco. So e-cigarettes do not contain tobacco. Yes, they can contain nicotine. Yes, they can contain very harmful substances, but they are not regulated. That is why, for example, right now on Take a Lot, you can actually buy a vape, an e-cigarette, for a cash delivery option in South Africa. So they basically they don't fall under the existing regulations. That is why, as the National Council Against Smoking, we've been advocating for the tobacco control bill, which is now in Parliament. I think the next provincial public hearings are actually going to be in Mpumalanga, and we've been advocating for this bill because one of the key things that this bill introduces is regulation of e-cigarettes. We'll see that government will be able to step in to regulate the ingredients, to regulate the flavors, to ensure that there are adequate health warnings, to ensure that the packaging as well is appropriate, etc. So we've really been advocating for regulation because currently it is not regulated. And like you're saying, we're starting to see a lot of kids starting to use e-cigarettes, and that really is detrimental for their health. And scientific evidence also shows that once kids start to vape, they are more likely to actually convert to starting to smoke the traditional cigarettes as well. So these are some of the science that has been published globally, and really even the WHO has raised caution that we need to put regulations to ensure that we stop kids' initiation of this very dangerous product.
I see that other effects of vaping can be the change in oral health, a loss of hair. It's even mentioning that it's been linked to erectile dysfunction as well. Are there enough studies on the harmful effects of vaping, or is it still in the discovery phase?
So currently, it's still in the discovery stages because vaping is a relatively very new product. If you compare to cigarettes have been there for a long time, and it took over 50 years for the public health community to really understand what smoking can do. And even in those stages, we know that the tobacco industry was trying very hard to try and hide the truth from the public, even if they knew actually, for example, that nicotine was addictive. They knew that cigarettes were very dangerous, but they hid the truth just to make profit. So we knew this over so many years. So for e-cigarettes, we don't know the long-term effects. The long-term effects can only be known after we start to see how it actually harms the body over time, 50 years or more. But in terms of short term, we already know that there are concerns with short term. I think I did mention lung health, heart health already, a high risk of stroke, etc. And I did say, for example, that nicotine does harm brain development for kids. So short term is already showing that we do have a problem. But in terms of long term, that we'll have to wait and see. But we cannot experiment with children when we know that for sure this product is harmful. So when the tobacco control bill, we're hoping that when it gets passed, it will regulate this product. It won't ban, meaning the adults can still actually use the e-cigarettes. They can still buy, they can still access e-cigarettes, but we need to really regulate tightly to ensure that more kids don't start to vape. Because as you see, nicotine is still the same addictive substance that is in cigarettes, that is also in vapes. We need to stop addiction. We need to stop child addiction.
Thank you so much for your time and sharing those insights with us. Dr. Sharon Nyatsanza, who is Deputy Director for the National Council Against Smoking.